Let's talk about this New York Times article about getting your cholesterol checked. Now, I was tagged in this from Dr. Lesko on Instagram, and she states that the article on cholesterol made no mention of menopause or estrogen effects on lipids. Men are still the default patient in medicine. Let's change that. So the author is not a doctor, not a healthcare professional, though she did interview a few for the article. The recommendations are very, very basic, but again, are men's medicine, not really applying to women. I say this because of this groundbreaking article published in November of 2020 by the American Heart Association in Circulation magazine. Women develop coronary heart disease several years later than men, with a notable increase in disease risk during midlife, a period coincident with the menopause transition. They did a deep dive in how lipids are affected by the menopause transition, specifically noting that total cholesterol, LDL-C, and apolipoprotein B levels increased dramatically within a relatively brief time span from the year before to the year after the final menstrual period. None of this was mentioned in the New York Times article. The data for primary and secondary prevention of atherosclerotic coronary vessel disease and improved survival with lipid-lowering interventions remain elusive for women, but not for men. Fatal and non-fatal myocardial infarction and all-cause mortality were not reduced with statin therapy across the entire cohort of women. And in another study, again, statins did not decrease for women, only for men, the risk of a heart attack or all-cause mortality. I think it's important when major magazines are making blanket recommendations that they realize that women are different than men, our medical needs are different, our presentation is different, and our management and treatment should be different and recognized.